In this three-part video series, I'll be discussing some of the most common types of medical malpractice cases: failure to diagnose cases, hospital mistakes, and medication errors. In this, our first video of the series, I'll be talking about failure to diagnose claims. Failure to diagnose really falls into two categories. One, where doctors and healthcare providers simply make the wrong diagnosis, and two, when there's a failure to make the diagnosis on a timely basis, even if the diagnosis is correct. We know statistically these types of claims account for almost 1/3 of all malpractice cases that are filed. It includes cases that arise in the outpatient setting when you're in your doctor's office, outpatient testing, diagnostic results, and even failure to communicate between multiple physicians. Many times these claims are not discovered by the patient until months or years later. This involves our analysis of the statute of limitations whenever a claim like this is investigated. In Florida, the statute of limitations is 2 years from when the patient knew or should have known of the negligence. Now, for some cases, it's obvious when that time starts running. For example, if I went in and had surgery on my right knee and I came out with a bandage on my left knee, I would know that very day that there was negligence that occurred because there was a mistake. But many times with a missed or delayed diagnosis, the patient often doesn't know until they receive a correct diagnosis sometime later. An example is we've had cases where patients go in for an annual physical, and as part of that they get a chest x-ray and they're told that there's nothing there. A year later though, they've developed symptoms like shortness of breath, and a follow-up chest x-ray is done which shows that there's a mass present. When they go back and look at the prior chest x-ray, they find that the mass was already there a year earlier. Even though that's when the actual malpractice occurred, the statute of limitations isn't going to start until the patient got the correct diagnosis a year later. If you or clients of yours have cases involving failure to diagnose like I've just discussed, please contact us. We can help you and your clients get answers. Stay tuned for our next video in the series, which will discuss the second most common source of malpractice cases, which are claims based on hospital mistakes.